Thank you so much, Chair Brownlee, and I thank all of our witnesses who are here today for us. I'm a 24-year military veteran, so this hearing is of interest to me, and I'll also say that I'm a supporter of the Hyde Amendment, where federal funding does not go to fund abortion. Dr. Miller, in 2016, the Bipartisan Commission on Care specifically recommended that, quote, the President or Congress task another body to examine the needs for changes in eligibility for VA care and/or benefits, end quote. Given that eligibility criteria have not been holistically examined in 26 years, please explain VA's opposition to H.R. 1216, the Modernizing Veterans Healthcare Eligibility Act, and why you think that Congress should continue to address eligibility in a piecemeal manner.
Thank you for your question. Thank you for your service as well. Mr. Miller?
Again, thank you for your question, Representative Miller-Meeks. And VA has several concerns with the proposed bill and opposes it as currently written. The intended outcome of the commission is not clear. Depending upon the composition and focus of the commission, it may recommend narrowing eligibility or expanding eligibility, or both, but in different ways or for different rationale. We're particularly mindful of the potential effects changes to eligibility may have on our current beneficiaries. We would appreciate the opportunity to discuss with the committee any of the underlying concerns involved in motivating this bill, as we may be able to identify alternatives to strengthen the system or make the committee aware of ongoing changes and improvements we have with our eligibility system. For example, we have previously recommended to the committee that we engage in discussions to address complexities associated with VA's emergency care reimbursement authorities. Conducting a comprehensive assessment of eligibility may be complicated given the uncertainty of how these efforts will unfold. This may again suggest the value of a more focused approach. We believe flexibility, particularly regarding military environmental exposure, is very important, and we are keeping an eye on the PACT Act legislation. We believe that a single standard for eligibility in this area could prove inadequate to the future needs of veterans and their families. And I thank you again for the question.
So would that mean that you support the other bills that we're discussing today that expand eligibility if you're concerned about being able to provide care to the veterans to whom we're providing care currently, i.e. H.R. 1957? A service which is currently not provided, for which the VA does not have expertise, either in abortion or in fertility treatments.
Yes, we're in favor of producing the right results for veterans. We are aware that we have limited resources available, and we are looking at key areas where expanding health care can have immediate impact, specifically on those areas that may have been previously underrepresented or previously been ineligible due to outdated policies such as don't ask, don't tell.
So I'm confused. I'm just a simple doctor and a simple veteran in a rural area, and so you're in support of certain policies, but you're not in support of modernizing Veterans Health Care Eligibility Act, which would also have the effect of offering services to populations that have been underserved.
I don't want to mischaracterize what I was saying. I'm very proud of the work that under this committee, the greater committee as a whole, that we have done to modernize eligibility and enrollment and to expand eligibility and enrollment. The concern that we have with this particular bill is the formation of a commission that may be unclear as far as what the underlying results or the drive of that commission would be.
I think that's exactly why an eligibility commission could perform a valuable service. And I think that an effort to refine multiple, complex, often competing standards and rules and bring them into the 21st century would ultimately be of greater benefit to a greater number of veterans such as myself. Thank you.